Hello guys, welcome to the channel Your Study Mate. So today's topic is about radius. So let's see the topic radius. While describing the bone radius, one need to describe that it has an upper end as seen in the picture, which is disc shaped and the narrow neck, and the lower end presents a tubercle of the posterior surface, and it is known as the tubercle of Lister, which is a main factor for the determining the side of a bone. At the lower end, the anterior surface is in the form of a thick ridge, while the posterior surface presents four grooves in which the extensor tendons pass. Next, while entering to the features to be discussed, the head is disc shaped and is covered with hyaline cartilage. It has a superior concave surface which attaches to the capitulum bone of the humerus, forming the elbow joint. And the circumference of this head also is articular, as it articulates with the annular ligament also. And next, coming to the neck, it is enclosed by the lower margin of this annular ligament. Head and the neck are free from the capsular attachment, so thus as the neck and the head are free from this capsular attachment, the rotation of the radius bone over the ulna is so easy, and it is very flexible for this bone to rotate over the ulnar bone. And next, coming to the radial tuberosity, which lies on the medial surface of the bone, which has two surfaces, that is posterior and anterior. The posterior part is roughened and the anterior part is smoothened part. Next, we have the lower border, or the lower end is the widest part of the bone as seen in the picture. The anterior surface is in the form of the prominent ridge on its lower surface. The radial artery is palpated against this surface. The posterior surface presents four grooves for the extended tendons to pass. The lateral groove, which is an important groove, will be discussed later, and the medial surface is occupied by ulnar notch to the head of the ulna. As you also, and now entering into the lower end of the bone, it is the widest part of the bone and has five surfaces. The anterior surface is in the form of thick prominent ridge, while the radial artery can be palpated against this surface. The posterior surface presents four grooves, in which an oblique groove is oblique to the tubercle of Lister, and the medial surface is occupied by ulnar notch for the head of the ulna. The lateral surface is prolonged downwards to form the styloid process, an important process for the determination of the side of the bone, as it is always present on the lateral surface. While holding a bone in an anatomical position, you may come to know it is of the right side or of the left side. And next, the determining factor is the tubercle of Lister, which is always present on the posterior surface of the bone. These both styloid and the tubercle of Lister makes together the side determining factor of the bone, including with the radial tuberosity also. And next, entering into the shaft of the bone, the shaft consists of three borders. The anterior border extends from the border which extends from the anterior margin of radial tuberosity. As this border merges downwards, it is oblique on its upper one-third, and while getting to the lower two-third portion, it is vertical and sharp, forming a ridge on its lower part and ends nearer to the styloid process. The posterior border is a mirror image of the anterior border, as you are seeing in the picture. It is clearly defined only in its middle of the third parts. The posterior or the upper oblique part is known as posterior oblique line. The middle or the interosseous border is an important border and the sharpest border among the three, as it gives attachment to the interosseous membrane, which helps in the weight transmission from bones. So it is the lower part which gives attachment to the interosseous border, and the interosseous membrane or the medial border also has an elongated triangular surface in which it accommodates the head of ulna. While entering the surfaces, the anterior surface which lies between anterior border and the medial border, which consists of the nutrient foramen, which runs opposite to the growing end of the bone, that is above of the bone or upwardly directed. And coming to the posterior surface, which lies between the posterior and interosseous border. And finally, we have the lateral surface that lies between the anterior and posterior borders. It also shows a roughened area in its middle part, which acts as a demarcation of this surface. Now, let's enter into the topic of attachment of muscles. The first muscle to be described is the biceps brachii, which is inserted into the rough anterior part of the rough posterior part of the radial tuberosity, which helps in the pronation of the bone. And next we have the supinator muscle, which is inserted into the upper part of the lateral surface, which helps in supination of the bone or stabilization of the bone. Next we have the pronator teres, which is inserted into the middle of lateral surface. By the name it says that pronator in the sense which helps in pronation, that is pronating of the bone. Next we have brachioradius. Next, a muscle which originates from the brachium and gets attached to the radialis bone. On its lateral surface above the stylotosus, which also helps in pronation of the bone. The lateral head of flexor digitorum superficialis also gets originated from the anterior oblique line and on the upper above border of the anterior surface. Flexor pollicis longus, the muscle of the thumb, which also arises from the upper toothed portion of the anterior surface. And last we have the pronator quadratus, which originates from the ulnar bone and gets inserted into the medial portion on the lower surface or the lower border, which helps in pronation of the bone. And last we have the muscles of the thumb, that is abductor pollicis longus and extensor pollicis brevis, arising from the posterior surface. And at last, the ligaments should be described, which is very important for the stabilizing of the bone. The quadrate ligament attached to the medial surface of the neck, which stabilizes the bone when it is pronated. The oblique cord, which is attached on the medial side just below the radial tuberosity, also helps in the stabilization of bone when it is pronated. The articular capsule of the wrist joint is attached to the anterior and posterior margin of inferior articular surfaces so that the muscle can be rotated easily. The articular disc, which is present on the lower surface of ulna and radial bone, which helps in the formation of wrist joint. And next we have the interosseous membrane, which is attached to the lower 3/4 part of the medial border, which helps in transmission of weight from ulna to the radius to upper parts of the limbs. Next, at last we have to describe the grooves which are present on the posterior surface, in which the muscles are transmitted. In the next video, we are going to discuss about the ulna and arteries of this bone. So thanks for watching.